In East Tennessee, more people are requiring hospital stays for COVID-19. Let me get out of the way and show you where we stand right now. You see that number 659? Yes, that is where we are. People undergoing treatment for the virus right now in hospitals. They aren't sure when this variant will peak, but you can see where the other peaks have been at 757 and 671. The rising volume of patients is taking an even greater toll on healthcare workers.
Mentally draining.
It's awful.
It's terrifying.
We spoke to 3 nurses at Methodist Medical Center in Oak Ridge, and 10 News reporter Grace King explains what this surge has been like for them.
We are getting hammered, and everybody has COVID.
Inside Methodist Medical Center, these nurses are tired.
We are burnt out. We are exhausted.
2 years of fighting COVID-19 is catching up with them.
And some of those patients just don't leave. They won't get to go home again to hug their family or tell their family they love them. And it hurts.
Bethany Englehart wanted to follow her mother's footsteps as a hospital nurse. Now she's leaning towards a career in mental health.
I can't do the death anymore. It takes a little piece of them every time that they watch something happen.
Barbara Hale came to the United States as a nurse 3.5 decades ago.
There was a shortage of nurses back then.
This time feels different.
COVID isn't the problem anymore. COVID is the straw that broke the camel's back.
She works part-time at the hospital to protect her mental health.
We keep hoping that we are seeing the peak. We keep hoping that this is the last wave, but we are preparing for the next wave.
Claudia Burton works extra 12-hour shifts every week.
My life is literally working at the hospital, just as my other colleagues are.
She says this wave is more challenging because so many of her colleagues have left.
We have lost so many nurses in our hospital, and I'm sure it's like this everywhere. Every single floor doesn't have enough staff.
The support is falling short too.
We will get through it, but we need a little help. And the facilities are going to have to help us and do something.
Still, these nurses love caring for others and show up day after day.
We're not going to give up just because we're tired.
I love nursing. I still love it. We're doing our best.
Our hearts go out to them. Take a look at this graphic and you'll see why they're so worried. This was January of last year. That is January of this year. A huge spike there. For the first time since late November, Knox County is reporting fewer COVID cases this week than the week before. That's encouraging. More than 5,800 new cases were reported in the last week. And as you can see in the chart there that we just showed you, the number may be lower than last week's, but still the 3rd highest that we have ever seen. You're looking at January of last year, September of last year, and again, January of this year. Again, the number of people going to the hospital for treatment continues to rise right now across 19 East Tennessee hospitals. 659 people are suffering from COVID-19 symptoms.